Can my boss force me to get vaccinated? Who has the authority to enact vaccine mandates? Who can ask about my vaccination status? These are some of the questions society has been grappling with as we've begun to open up after months in relative lockdown amid a global pandemic, and in some places the fights are heating up.
Could mean police officers and firefighters are not exempt.
This testing will not be done on our own time or our own dime.
If you want to go out and have fun and go into a restaurant or a bar, you're going to have to get vaccinated.
Yeah, it was a no-brainer. I'm still not taking it.
One of the most public places these disputes are playing out is in the federal government. President Joe Biden said he won't mandate federal employees get vaccinated, but unvaccinated federal employees will have to submit to frequent testing and mask wearing. This approach is what's known as a soft mandate.
A hard mandate is basically vaccinate or you're fired, if we're talking about the mandate in the workplace. A soft mandate is a mandate that says vaccinate or do these other things. In the past, hospitals, for example, said vaccinate or mask. You're not being fired if you don't vaccinate, but there may be additional burden to reduce the risk you pose to others.
Soft mandates like these are increasingly being used by workplaces. Even the NFL announced that players will not be required to get vaccinated, but any game that's canceled due to COVID will count against the team responsible for the outbreak. Forfeited games will count against a forfeiting team's record, and players won't be paid for forfeited games. But when it comes to private entities, the law is increasingly coming down on the side of those who wish to impose mandates.
So if you've ever been to a restaurant down the shore and it says no shoes, no shirt, no service, vaccines can be thought of in the same way. No vaccination, no service.
But there's still some legal uncertainty there.
The vaccines have been authorized by the FDA for emergency use authorization, which means they've gone through rigorous testing. However, they don't have full approval.
The reason for the legal uncertainty is that the EUA law tells the Secretary of Health and Human Services to inform recipients that they can accept or refuse the vaccine. Some people say, if people are told they can accept or refuse the vaccine, that means no mandate. On the other hand, the Act also tells the Secretary to inform people of potential consequences. So there may be consequences to refusal, including maybe being fired. And further, the Act only talks to the Secretary of Health and Human Services, not to employers, not to universities, not to states. So reading into that act a global prohibition on employers and universities and state to do something they have long held the authority to do is reading a lot into it.
Now, there are two exceptions that employers and universities need to make note of. So the first is the Americans with Disabilities Act. And so what that means is if someone has a medical reason that they can't get vaccinated, there needs to be accommodations for that. And then the second exception is for religious objections. So people who don't get vaccinated for religious reasons, you also have to make accommodations for that. A reasonable accommodation, there is no strict definition that currently exists.
Testing or mask can be a reasonable accommodation. You say, we will let you work just as everybody else, but you have to meet these additional requirements to reduce the risk. You have to test twice a week. You have to mask. Another accommodation, and it's really going to depend on the workplace whether this is possible, is allowing employees that do not want to vaccinate to continue working remotely. Generally, reasonable accommodation is a case-by-case question. It depends what the workplace environment is, what the job is, etc., what would count as reasonable.
I think that there's a lot of confusion around this because there's this law called HIPAA that has to do with privacy of your healthcare information. But the thing is what HIPAA says is that your doctor or your health insurer can't share information without your consent. It doesn't say that a restaurant can't ask you personally and then you say yes or no. So restaurants and stores definitely can ask about your vaccination status. It's just your doctor or your health insurer can't share it without your permission.
These disputes are already playing out in the court. In June, more than 150 employees at a Houston hospital system who refused to get the COVID-19 vaccine were fired or resigned after a judge dismissed an employee lawsuit over the vaccine requirement. And in August, a judge ruled Norwegian Cruise Lines can require passengers to be vaccinated after Florida Governor Ron DeSantis put a law in place banning all vaccine passports in the state. DeSantis also signed a law in July banning school districts from imposing mask mandates for students, an order some school districts in the state are already planning to defy.
What has happened with the COVID-19 vaccine is states, and particularly Republican state legislatures, are passing laws that are being signed by governors that say there can't be a vaccine passport. You can't mandate COVID-19 vaccination for employment. You can't mandate COVID-19 vaccination in order for kids to go to school. There's a great resource called the National Academy for State Health Policy, and they have been tracking all of the different states that are passing laws relating to COVID-19 vaccination. And so as of the beginning of August, there are 7 states that have passed laws that say employers can't mandate COVID-19 vaccines. And again, just to put this in context, all states right now require certain vaccines in order for kids to attend public schools. And it's with COVID-19 that we're seeing these laws that are specific that say you can't mandate COVID-19 vaccination.
The vaccine hasn't been authorized for children under 12 yet, but as of August 6th, 59% of people above 12 have been fully vaccinated according to the New York Times. And convincing people to voluntarily get vaccinated could help slow the spread of the virus, making mandates less necessary.
So they can offer incentives. They can say, we'll give people who vaccinate money. Some of them have done that. We'll give people who vaccinate paid leave, ranging from 4 hours to 2 days that I've seen. You can recommend the vaccines to your employees. You can provide education, and you can make access easy by bringing vaccination to the workplace. Some people may have access issues. They don't have time to take time off to go get vaccinated. So bringing the vaccines to the workplace can help them.
What polls have found is that people believe their primary care doctors. And so there is a lot of misinformation going around. And it's totally fine if people are confused, if they're worried about getting the vaccine. That is a natural reaction. And so what I would really encourage is talk to your doctor, talk to your pediatrician, and they can answer any questions that you have. And I would just stress that, yes, the vaccines have this title, emergency use authorization, and that an emergency can sound scary, that there isn't enough research, but really what all public health professionals are stressing is the best way to protect you, to protect your family, to protect your community is to get vaccinated.